Hi guys, and welcome back to my YouTube channel. Today we're going to discuss what is infective endocarditis. This is an issue where there hasn't been many videos, and so I decided to make a video on this issue. Now, infective endocarditis is a disease associated with the layers of the heart, specifically of the endocardium, which is the deepest layer of the heart, which lines both the chambers and the heart valves. This disease occurs when fungi or bacteria found in other areas of the body spread via bloodstream to the heart and inflict damage. Untreated endocarditis can damage heart valves as the bacteria and fungi will grow inside the heart, forming vegetation that can eventually break off and spread to other areas such as the brain, lung, kidneys, and even the skin. Growth in the heart and spreading to other areas can be life-threatening. Individuals with endocarditis tend to display a variety of signs and symptoms. These symptoms can develop gradually over a long period of time or be sudden depending on the type of infection an individual has. If an individual has other heart problems, endocarditis can exacerbate this. Some of the most commonly associated symptoms of bacterial endocarditis include a new or change in a heart murmur, which is the sound of blood as it passes through the heart, pain in joints and muscles, trouble breathing, and chest pain when an individual breathes, flu-like symptoms such as fevers or chill, sluggishness, fatigue, and reduced energy to carry out daily routine. Night sweats and swelling in feet, leg, or abdomen are some of the few commonly associated symptoms and signs of bacterial endocarditis. If you develop any of these signs or symptoms and they do not go away, seek medical attention as soon as possible. Some of the causes of endocarditis include an infection or other medical condition that can spread bacteria from an infected area, like skin sores, gum disease, or other sexually transmitted infection, into the bloodstream. Dental procedures can cause bleeding of gums, which can allow bacteria to enter your bloodstream and then spread. Catheters may already have pre-existing bacteria, which can then get transmitted into the individual. Needles used during tattoos and body piercing, if they're not sterilized properly, can carry bacteria onto recipients during a tattoo or body pierce. Everyday oral activities like brushing and flossing can cause bleeding, which can enable bacteria to travel through the bloodstream. Additionally, not flossing and having unhealthy gums can also enable bacteria to go and travel into the bloodstream. Lastly, intravenous injection of illegal drug like heroin, similar to tattoos, may use needles and syringes that are not clean. So you might be wondering, who is at risk for endocarditis? Well, if your heart is healthy, you are less likely to develop endocarditis. However, studies have shown that patients with chronic rheumatic fever have a greater risk because of damaged heart valves. In congenital heart defects and acquired valvular dysfunction, circulating bacteria tend to stick to and multiply on damaged valves, increasing the risk of infection. Bacteria are also more likely to stick and multiply on a prosthetic heart valve as compared to a normal heart valve, which puts patients with artificial heart valves at a greater risk of infection. Patients that previously had endocarditis have a greater risk of future infections, as well as people that use illegal drugs through injection because the needle can be contaminated with bacteria, which can cause endocarditis. Along with this, poor dental hygiene can also allow bacteria to spread into the bloodstream because of tooth decay, which can then cause endocarditis. In order to prevent this, several preventative actions can be taken against endocarditis, which include recognizing the symptoms and seeking medical care immediately, while also maintaining good oral health with regular dental checkups mentioned previously with poor dental hygiene. Avoiding any procedures, such as piercings or tattoos, that have the potential to allow bacteria into your bloodstream, along with prescribing preventative antibiotics before medical procedures and surgery for patients at high risk for endocarditis. Now on to diagnosis. A proper diagnosis of endocarditis is very important, as overdiagnosing can lead to weeks of unnecessary antibiotic treatment, and underdiagnosis can lead to death. So to start, your doctor will take a detailed history and clinical examination to determine if you have any symptoms of endocarditis, such as fever or have recently had any type of surgery. Then the doctor will do a blood test. The blood test must be done before the start of treatment and can determine if there are any bacteria or fungal infections present, and isolate the specific bacteria which is causing the infection. This determination will be necessary later to identify which antibiotics will be the most effective for the infection. Next, diagnostic imaging can be used to determine the extent of the damage the infection has caused. X-ray, CT scan, and echocardiogram or ultrasound of the chest are all excellent choices. This will allow the doctor to determine how much damage the infection has caused, and also the echocardiogram can be used to determine if the heart is functioning, as well as find any abnormal inflammation or damage caused by the infection in the heart. So now on to treatment. Treatment of endocarditis primarily involves antibiotic therapy and, if need be, surgery. There is a wide variety of antibiotics that may be used. However, it is important to first identify which causative agent is responsible for the infection. Strains of bacteria vary in their susceptibility or their resistance to various antibiotics, and it is therefore important to plan the antibiotic regimen accordingly. The most common microorganism implicated in infectious endocarditis is Staphylococcus aureus, which accounts for roughly 31% of all endocarditis cases. This specific strain, for example, is often resistant to penicillin but susceptible to oxacillin. Therefore, a regimen of oxacillin for around 6 weeks is often used in these cases. Due to the vast variation in the infection type, there are many potential treatment regimens which may be prescribed. Moving on to surgery as a potential treatment. Endocarditis may compromise the integrity of heart valves, potentially leading to the need for surgery. For example, the infection may cause a leaky valve known as valve regurgitation. If this progresses to moderate or severe heart failure, surgery may be indicated. Other complications potentially requiring surgery include blood clots, abscesses or aneurysms around the aortic valve, emboli, or in the case where the infection is at a previously replaced valve, an unstable prosthetic valve. Overall, thank you for listening to my video. I hope you learned a little bit more about bacterial endocarditis. I'd just like to remind you that this video was made for scientific accuracy, but it's not a substitute for medical advice. Consult your doctor for more information.